to cure cancer? Sounds pretty good, doesn't it?
Yeah, that is certainly the promise. Targeted drug therapy to get rid of cancer as easily as doctors are now treating pneumonia. Researchers will tell you we're closer than ever, and it's already a reality for certain cancers. K2's Natalie Marmion introduces us to a local cancer doctor who's about to be featured on Dr. Oz with the encouraging news.
We've completely revolutionized the way we think about and treat cancer.
Dr. Brian Druker is a familiar face in cancer research. Now head of OHSU's Night Cancer Institute, he came to Portland to begin his work in targeted therapy 16 years ago. His discovery of Gleevec, which targets cancer cells in leukemia patients without harming normal cells, has saved countless lives.
Could I ask Dr. Brian Druker to please join me at the podium?
Just last week, he was recognized with Portland's first Citizen Award. Thanks to his focus on targeted therapy, there are now hundreds of these drugs right now in clinical trials armed to target different cancers.
Right, we're absolutely breaking it down. We're understanding what makes it tick, and we're actually targeting it at the very heart of the cancer.
Rob Schick is one of his patients.
You hear the word leukemia or the word cancer, and you think immediately of chemotherapy and the end of your life.
Feeling unusually wiped out, Rob went in for a blood test.
An unbelievable level of fatigue. I mean, there's fatigue, which we all get, and this was a get off your bike, trembling, upset stomach, just what is this?
With a white cell count off the charts, it was leukemia. But because of Gleevec, he never went through chemotherapy or radiation.
It doesn't mean that we're going to abandon chemotherapy and radiation, which we already know are effective, but it means that we're going to transition from non-specific treatments to highly specific, highly effective, and non-toxic treatment.
And Dr. Druker is encouraged about how quickly cancer research is progressing.
It took 25 years to identify the target for Gleevec. I can do that in my lab in 3 or 4 months now, identify targets in cancer cells. And so now we need to take those targets and turn them into drugs.
5 years later, and still taking a daily pill, any signs of Rob's cancer are minuscule.
It's just defined the rest of my life.
And we've now taken a disease which had a 3 to 5 year life expectancy, and now we assume that patients will live a normal lifespan, at least 30 or more years with this drug.
Natalie Marmion, K2 News.
It is about getting a lot more people focused on the problem and funding to speed up the process. Dr. Brian Druker will be featured on the Dr. Oz show tomorrow. The two will talk much more about the encouraging signs of targeted therapy, preventive therapy, and feature other patients who have benefited already from Gleevec.